Hi, my name's Cheryl Walker and this is my Unit 14 presentation on pregnancy and health. I will explore three important pregnancy-related health concerns: gestational diabetes, preeclampsia and substance misuse during pregnancy. Firstly, I will discuss gestational diabetes, including its risk factors, diagnosis and care plans. Then I'll look at preeclampsia, identifying the risk factors, signs and symptoms, and the importance of monitoring and care to prevent serious complications like eclampsia. Finally, I will address the dangers of substance misuse, focusing on the effects of alcohol and illegal drugs on both the pregnant mother and their baby. My presentation aims to provide key insights into the development, diagnosis and management of these conditions to ensure healthier pregnancies for both mother and baby. Gestational diabetes: the development, diagnosis and care of gestational diabetes. Gestational diabetes is a condition that develops during pregnancy and can lead to complications if not managed properly. Certain factors increase the likelihood of developing gestational diabetes, and understanding these risk factors is crucial for early detection and prevention. In this section, I will explore the key factors that contribute to the development of gestational diabetes and the importance of identifying them early. Gestational diabetes is diabetes diagnosed for the first time during pregnancy. It typically disappears after birth, and it is common during the second or third trimester. However, it can occur at any point during pregnancy. It occurs when there are high levels of sugar, known as glucose, in the system. Insulin is a hormone which helps control blood sugar levels. Gestational diabetes can cause problems for you and baby during and after pregnancy and birth. Risks can be reduced if the condition is detected early and managed well. Who is at risk for gestational diabetes? While any woman can develop gestational diabetes during pregnancy, certain factors can increase your risk. You may be at higher risk if you're over the age of 40, your body mass index is above 30, you had gestational diabetes in a previous pregnancy, close family members such as parents or siblings have diabetes, and you're South African, Black, African Caribbean or Middle Eastern descent, even if born in the UK. You underwent weight loss surgery such as a gastric bypass, or you've previously given birth to a baby weighing 10 pounds or more at birth. If any of these factors apply, screening should be offered for gestational diabetes during your pregnancy. What is gestational diabetes? Diagnosing gestational diabetes is essential for managing the condition and preventing complications. It typically involves screening tests to identify high sugar levels during pregnancy. It can develop at any point in pregnancy, but is more common in the second or third trimester. This occurs when the body is unable to produce enough insulin, the hormone that helps regulate blood sugar, to meet the increased demands of pregnancy. While gestational diabetes can lead to complications for mother and baby, the risk can be minimised with early detection and proper management. Gestational diabetes is typically tested for between 24 and 28 weeks of pregnancy. However, pregnant women who are at higher risk of developing the condition may be offered earlier testing from their doctor. It is diagnosed through blood tests, although a glucose challenge test or an oral glucose test or both may be offered. These tests measure how effectively the body passes glucose. Gestational diabetes testing. Glucose challenge test. Blood is drawn 1 hour after drinking a glucose solution. No fasting is required, and if blood glucose is 140 or higher, an oral glucose tolerance test may be needed. A blood glucose of 200 or more may indicate type 2 diabetes. Oral glucose tolerance test requires fasting for at least 8 hours before the test. Blood is drawn initially, then glucose solution is consumed. Blood is drawn every hour for 2 to 3 hours. Gestational diabetes is diagnosed if blood glucose is high 2 or more times, fasting 1 hour, 2 hours or 3 hours. A healthcare provider will explain the test results, and an OGTT may be recommended without first performing the glucose challenge test first. Gestational diabetes happens when the body does not produce enough insulin, a hormone produced by the pancreas which helps to regulate blood sugar levels, called glucose. Insulin helps to support the body of extra requirements needed during pregnancy. This can then cause issues such as the body producing increased amounts of amniotic fluid, which can then lead to premature labour. Baby being born larger than average, and this can lead to complications during birth and possible health issues for baby. Mother can develop a condition called preeclampsia, and baby can be born with jaundice or have higher chances of developing jaundice after birth. Baby can also be born with low blood sugar levels. There can be a higher chance of mothers who have further pregnancies to develop gestational diabetes, and it is possible for mothers to then develop type 2 diabetes after birth. Signs and symptoms of gestational diabetes. Gestational diabetes typically does not cause obvious symptoms and is often only identified through blood sugar screening during pregnancy. However, in some cases, if blood sugar levels become too high, hyperglycemia, symptoms may develop, including increased thirst, frequent urination, fatigue, blurred vision, dry mouth, and genital itching or thrush. These symptoms can also occur during pregnancy and are not always typical of gestational diabetes. Healthcare providers should be contacted if there are any concerns about any of the symptoms. Gestational diabetes care plan. Once diagnosed with gestational diabetes, the expectant mother will receive more regular antenatal appointments. Blood glucose levels are checked to ensure that they are being managed. Extra ultrasound scans may also be offered, which will allow healthcare providers to observe baby's development. An expectant mother will be provided with information and leaflets to support the condition. They will also be provided with information to control the condition through diet and exercise. A blood glucose monitoring kit will be provided to allow the expectant mother to regularly check their blood glucose levels, and information on how to deal with too high or low blood glucose levels will be given. Medications may be prescribed to help monitor and manage condition. The expectant mother will also be referred to a registered dietitian or diabetes educator. They can help to create a personalised meal plan that considers your individual needs, preferences and blood sugar goals. The mother should focus on whole, unprocessed foods, ensuring to prioritise fruits, vegetables, whole grains and lean meats and proteins. Limit carbohydrates and sugary foods and reduce the intakes of sweets, sugary drinks and processed foods. Close attention should be paid to portion sizes, and the mother should follow the healthcare provider's recommendations for appropriate portion sizes. This slide shows a table highlighting information on the effects of alcohol, illegal or prescription drugs and smoking and vaping during pregnancy. And this slide shows a table highlighting information on the impact of mental health, regular medical monitoring, labour and delivery planning, follow-up and prevention of future diabetes and emergency plans. Preeclampsia. Section 2. The development, diagnosis and monitoring of preeclampsia. What is preeclampsia? Preeclampsia is a condition characterised by persistent high blood pressure. It develops during pregnancy or after childbirth. It can be extremely dangerous. Complications can occur, such as liver and kidney damage, which can cause potential risks to both mother and baby. It may also lead to reduction in platelet count and harm to the placenta, kidneys or liver. It usually occurs between 24 and 27 weeks of pregnancy or shortly after birth. It can develop any time after the 20th week of pregnancy. What causes it? The exact cause of preeclampsia is not fully understood. It can develop from gestational hypertension, which is known as high blood pressure, over 140/90, which occurs during pregnancy without signs of kidney or liver damage. Gestational hypertension is more common in first pregnancies and in those involving twins or higher order multiples. Women who have experienced gestational hypertension in a previous pregnancy are more likely to develop it again. Women over the age of 40 increases the risk of preeclampsia as well as obesity. Having a BMI of 35 kilograms or greater at the first visit increases the risk. What causes problems with the placenta? Early in pregnancy, the fertilised egg attaches to the uterus and produces villi, which helps anchor it and grow into the placenta. Blood vessels in the placenta widen to supply nutrients to the baby. If these blood vessels don't fully transform, the placenta may not develop properly, leading to preeclampsia. The exact cause is unclear, but inherited genetic factors may play a role as the condition often runs in families. Signs and symptoms of preeclampsia. Signs and symptoms may vary from person to person, and some may experience a range of noticeable symptoms, others may not show symptoms at all. Persistent high blood pressure, protein in the urine, severe headaches, visual disturbances such as blurred vision or seeing spots, pain in the upper abdomen, nausea and vomiting, and swelling in the hands and face. The most common symptoms are high blood pressure, usually occurring after 20 weeks of pregnancy, protein in the urine, as this indicates kidney dysfunction, swelling, especially in the face, hands and feet, although swelling is common during pregnancy, although sudden or severe swelling should be investigated. Headaches, severe persistent headaches that don't respond to over-the-counter pain relievers, and vision changes such as blurred vision, seeing spots or flashing lights. Nausea and vomiting, persistent or worsening nausea and vomiting, and rapid weight gain, a sudden increase in weight. Less common or more severe factors include eclampsia, HELLP syndrome, a severe form of preeclampsia characterised by hemolysis, which is a breakdown of red blood cells. Organ damage to kidneys, liver, lungs, heart and eyes, and feeling very unwell. A general sense of being unwell or experiencing a sense of impending doom. Diagnosis: high blood pressure. A blood pressure reading has two numbers. The first number is a systolic pressure, a measure of blood pressure when the heart is contracting. The second number is diastolic pressure, a measure of blood pressure when the heart is relaxed. In pregnancy, high blood pressure is diagnosed if the systolic pressure is 140 millimeters of mercury or higher, or if the diastolic pressure is 90 millimeters of mercury or higher. Several factors can affect blood pressure. If a high blood pressure reading shows during an appointment, the healthcare provider will likely take a second reading 4 hours later to confirm a diagnosis of high blood pressure. If you have high blood pressure, your healthcare provider may order additional tests to check for other signs of preeclampsia, such as a blood test. A blood sample will be analysed to assess how well your liver and kidneys are functioning. It can also measure your blood platelet count, which are the cells responsible for helping your blood clot. Urine analysis. You will be asked to provide a 24-hour urine sample or a single urine sample to evaluate how well your kidneys are working and check for the presence of protein, which can indicate kidney damage. Fetal ultrasound. Your healthcare provider may recommend regular monitoring of your baby's growth, often through ultrasound. This imaging helps the baby's weight and measures the amount of amniotic fluid in the uterus. Non-stress test or biophysical profile. A non-stress test monitors your baby's heart rate and how it responds to movements. A biophysical profile combines ultrasound to measure your baby's breathing, muscle tone, movement, and the amount of amniotic fluid in the uterus. Monitoring. Treating preeclampsia. If you're diagnosed with preeclampsia, you'll be referred to a specialist for further assessment, usually in a hospital setting. While in the hospital, you'll be closely monitored to assess the severity of the condition and determine whether you need to stay for observation. The only cure for preeclampsia is delivering the baby, so you'll typically be monitored until it's safe for delivery. This usually happens around 37 to 38 weeks of pregnancy, although in more severe cases it may be earlier. When it's time for delivery, labour may be induced or a caesarean section may be performed. You will also be given medication to help lower your blood pressure whilst waiting on your baby to be born. Complications. While most cases of preeclampsia cause no long-term issues and improve after delivery, there are risks of serious complications for both the mother and baby. One of the risks is the development of seizures, known as eclampsia, which can be life-threatening for both mother and baby, though it is rare. Signs of the unborn baby. The primary sign of preeclampsia in the unborn baby is slowly growth. This occurs due to the reduced blood flow through the placenta, which affects the amount of oxygen and nutrients the baby receives. As a result, the baby may not develop as expected, a condition known as intrauterine or fetal growth restriction. If your baby is growing slower than normal, it is usually detected during your antenatal appointments when the midwife or doctor measures the abdomen. Treatment. Early pre-planned delivery of baby to ensure mother and baby are kept safe. Preterm birth may be dangerous for the baby. Healthcare providers will consider the best treatment options and consideration will be taken such as is the preeclampsia mild, severe and how long along your pregnancy is. Mild preeclampsia. Hospital treatment may be recommended or even at home as an outpatient. Baby's movements may be monitored as well as mother's blood pressure. Mother may be advised to avoid overexertion and rigorous physical activity. There will be more frequent prenatal checkups and blood pressure checks and blood tests will be performed at each checkup, as well as an ultrasound being given. Labour may be induced at 37 weeks. Severe preeclampsia. Treatment will be performed at the hospital if preeclampsia gets worse. Labour may be induced at or after 34 weeks and medication may be prescribed to help reduce blood pressure and prevent seizures. Corticosteroids may be given to help improve liver and platelet function and to help baby's lungs mature. Complications. If preeclampsia is not diagnosed and monitored, it can lead to serious complications for mother and the baby. Eclampsia is rare but serious, and eclampsia involves seizures that can occur after 20 weeks of pregnancy or within 48 hours of delivery. During a seizure, the mother may lose consciousness and her muscles may twitch involuntarily. Many women recover fully, but severe cases may cause brain damage. Magnesium sulfate is used to reduce the risk of preeclampsia. HELLP syndrome is a rare but life-threatening liver disorder. It affects the liver and blood clotting system. Typically appearing after 20 weeks of pregnancy, it stands for hemolysis, is the destruction of red blood cells, elevated liver enzymes and low platelets. HELLP syndrome requires immediate delivery of the baby and treatment in the hospital for recovery. Stroke. High blood pressure can affect blood flow to the brain, leading to a stroke which can cause brain damage or death. Long-term issues are organ problems, such as kidney failure, liver failure, and a higher chance of preeclampsia in the next pregnancy. Problems affecting the baby are growth restriction and premature delivery. Issues that may occur if preeclampsia is not managed. Eclampsia occurs when a pregnant woman with preeclampsia develops seizures, which can be a sign of severe preeclampsia. It is a complication of preeclampsia and a condition characterised by high blood pressure and protein in the urine, usually occurring after 20 weeks of pregnancy. Besides seizures, other symptoms of eclampsia include high blood pressure, headache, blurry vision and pain in the upper abdomen. Management of preeclampsia is early diagnosis and monitoring, medical treatment, delivery and postpartum monitoring. Substance misuse, the dangers of substance misuse in pregnancy. It is important to be aware when a pregnant woman in your care who takes illegal drugs not to judge but to support and offer factual advice. Research indicates that the use of tobacco, illegal drugs or the misuse of prescription medications by pregnant women can cause severe consequences for infants. This is because many substances can easily cross the placenta, meaning whatever a pregnant woman consumes can also affect the fetus. This slide shows a table highlighting information on alcohol, illegal or prescription drugs, smoking and vaping during pregnancy. Drinking alcohol during pregnancy poses serious risks to both the pregnant person and the developing baby, including fetal alcohol syndrome and organ damage. It can also increase the risk of pregnancy complications like miscarriage or stillbirth. Avoiding alcohol is essential for a healthy pregnancy. Light or moderate drinking can harm the developing fetus, and no amount of alcohol is considered safe. Infants born to mothers who drink during pregnancy can develop fetal alcohol spectrum disorder. The impact of illegal substances usage during pregnancy on baby after birth. Many drugs of abuse can pass through the placenta and affect the development of the baby's brain. Exposure to these substances before birth can have long-lasting effects on brain structure and function. The way they affect the developing nervous system is often different from how they affect fully developed systems, as the body's regulatory mechanisms are not fully established. Drugs during pregnancy. During pregnancy, the mother and the baby's health are top priority. While some medications are essential for managing health conditions, others can have risks that may affect fetal development. The figure here shows some examples of any risks associated with taking drugs during pregnancy. It is crucial to be informed and make decisions that prioritises both maternal and fetal well-being. Thank you for watching my presentation.